Respected teacher and my fellow classmates, Assalamu alaikum and welcome to today's presentation. The topic of our presentation is COVID-19, modes of transmission and prevention. By the end of our presentation, I hope everyone will have a fair understanding of how COVID-19 spreads and how we can keep ourselves safe from getting infected. The topic will be presented by me, SM Jawad Hussain, Mohammad Ashikul Islam Soar, Atikuzzaman Atik, and Nusaifa Nafsin Neha. So what is COVID-19? COVID-19 is one type of coronavirus. The virus has a genetic material or RNA enclosed by a lipid bilayer with protein spikes. In Latin, corona means crown. As the cross-sectional structure of the virus looks like a crown, it's called coronavirus. COVID-19, also known as SARS-CoV-2, is one type of coronavirus. The origin of the virus is suspected to be seafood market of Wuhan, which is located at Hubei province of China. The virus began spreading in December 2019. The suffix 19 of COVID-19 comes from year 2019. In 30 January 2020, World Health Organization declared COVID-19 as public health emergency of international concern. Why haven't we heard about COVID-19 before? Scientists suspect that COVID-19 outbreak is caused by spillover. When an animal-borne disease spreads to human as a result of various factors, such as mutation, it's called spillover. For example, other type of coronaviruses like MERS-CoV came from camels, SARS-CoV came from civet cats. But the origin of SARS-CoV-2 or COVID-19 is not yet known. According to www.statistica.com, as of 1st March, there are about 115 million known COVID-19 cases with about 2.5 million deaths worldwide. The mean infection rate is 2.5 persons per day. According to WHO, in our country, the current COVID-19 infection rate is about 3,000 people per week with weekly death rate of about 80 people. The graph shows infection summary of our country up to February 21. Now, Muhammad Ashikul Islam Soad will elaborate about the mode of transmission of COVID-19 from people to people.
Thanks, Jawad. Now we need to know when do infected people transmit the virus. Whether or not they have symptoms, infected people can be contagious and the virus is spread from them to the other people. Laboratory data suggests that infected people appear to be most infectious just before they develop symptoms and early in their illness. Severe ill people can be infectious for longer period. Now, mainly COVID-19 spreads when an infected person is in close contact with another person. The virus can spread from an infected person's mouth or nose in small liquid particles when they cough, sneeze, speak, sing, or breathe heavily. These liquid particles are of different sizes, ranging from larger respiratory droplets to smaller aerosols. Other people can catch COVID-19 when the virus gets into their mouth, nose, or eyes, which is more likely to happen when people are in direct or close contact less than 1 meter apart with an infected person. The virus can also spread after infected people sneeze, cough, or touch surfaces or objects such as tables, handrails. Other people may become infected by touching those contaminated surfaces, then touching their eyes, noses, or mouth without cleaning their hands first. Transmission of COVID-19 can occur more easily in 3Cs, crowded places with many people nearby, close contact settings, especially where people have conversations very near with each other, confined and enclosed spaces with poor ventilations. Now, Nusaifa will discuss how COVID-19 can be prevented.
Assalamu alaikum. I am Nusaifa. Actually, it is not possible to prevent COVID totally. Rather, we can take some precautionary steps. Our main concern is to flatten the infected curve. That means to reduce the number of affected people in a certain period of time so that it does not go beyond the capacity of remaining healthcare system. And for precaution, the best thing one can do is to avoid exposure. We have to practice social distancing at all possible times. A virus only spreads if it has someone new to infect. So if everyone puts at least 6 feet distance between each other, the virus will have nowhere new to go. We will have to avoid social gathering like party, restaurant, club, visiting family gathering as much as possible. But avoiding gathering or maintaining distance is not always possible for various reasons. So one should have to wear mask to reduce risk. The virus passes through sneezing, coughing, and also while talking from an infected one to a non-infected one. Obviously, an individual particle is very small to pass through cloth, but the coronavirus almost never travels alone. COVID-19 mainly spreads in form of droplets with moisture that comes out of our mouths and noses. The fabric of masks work to capture these droplets. So mask gives two levels protection. It prevents the virus to come out from an infected one and to go into a non-infected one.
Thank you, Nusaifa. Now I am going to talk about right ways to wear mask. Clean your hands before you put your mask on, as well as before and after you take it off, and after you touch it at any time. Make sure it covers both your nose, mouth, and chin. When you take off a mask, store it in a clean plastic bag, and every day either wash it if it is a fabric mask or dispose of a medical mask in a dustbin. Don't use mask with bulbs. Wash your hands frequently before eating, after coughing or sneezing, after blowing nose, after touching plates. While cooking, every time wash your hands properly. COVID-19 virus can take place in surfaces, so make sure you disinfect the surfaces with proper disinfectants. Avoid touching your face when you are home or away. It's the easiest way for the virus to enter into your body. When you are sneezing or coughing, cover your mouth with arm or tissue paper. If you use tissue paper, then deposit it in a closed bin and wash the bin every day. That's all from us. If you have any queries, feel free to ask. Thank you.